drew me to plastic surgery is really the ability to change these people's lives. I really like the fact that we work from head to toe. I really like the fact that we have a really long relationship with our patients. In reconstruction, a lot of times we see people at their lowest, and then we can provide reconstruction to restore their body to what they used to have. And in the cosmetic realm, we get to enhance parts of their body that they don't like, parts of their body that might really affect them mentally and physically, and eliminate that to make them feel better about themselves. I originally came here because my parents actually live locally in Lathrop, California. As I've been here for the last 4 years, I really grew to love the Central Valley people. I love the patients here. I think they're down to earth. I think they're grateful to have medical care. Fortunately, I'm one of the few plastic surgeons in Central Valley, so I get to see people from Fresno all the way up to Sacramento. And I really connected with the population here. I'm happy to provide the service for them. If I was not a plastic surgeon or a physician, I think my dream job would be to be a chef or a cook, because I think the process of cooking is a lot like surgery, where you have a number of steps and then you get to create something at the end. I think the most rewarding part of working in healthcare for me is doing a great job for patients and getting the sense that you really help somebody in their life, not just to look better, but to feel better. I think even if something that we do for patients is very minor in the physical sense, affects them mentally, if it affects them in a way that they can feel better about themselves, I think that's the most gratifying thing I do as a plastic surgeon. A unique challenge in my practice as a plastic surgeon would be every problem is really quite different in my sense, because every body is different and every problem in reconstruction is a different type of problem. Luckily, as a plastic surgeon, that we're trained in principles, we're not trained in just doing a specific surgery, so I can apply the things that I learned through training and residency and apply it in new ways. I frequently do surgeries that I haven't performed for many years. I'm able to provide the results that the patients would like. An advice I would give to my younger self would be to always be patient through the process. I think a lot of times as a surgeon, we seek instant gratification. However, a lot of times that these things take, especially in reconstruction, these processes take a long time. It's been a journey through all of our patients, and I think that's probably something that I would remind myself of.